Everyone. Today we are going to start with our new topic, external ear. Okay, which is a topic of the ENT. So let's start with the embryology part. So where does the development from the first arch the tragus develops, and from the second arch the rest of the pinna develops. Okay, now let's see the parts of the pinna. So this triangular part it is the tragus part. Okay, first of all let's see that is the outer rim of the pinna. Okay, the outer rim of the pinna, which is known as the helix part. Okay, and lowermost part of the helix, it is the lobule, which does not contain no cartilage, only fat is present. Whereas the lowermost part, it is also the site for the piercing. Okay, it is safe because if we pierce in the cartilaginous part, it can be infectious. Okay, and it can damage the cartilage. Okay, which can lead to further perichondritis. Okay, now this one is the helix part, and this one is the anti-helix part. The anti-helix part is composed of two crura. Okay, and between the two crura there is a triangular fossa. Okay, now between the helix and the anti-helix there is scapha. Scapha is the area. Okay, now first of all let's see, here is a triangular curve which is known as the tragus part, and opposite to it, this one, it is the antitragus part. Okay, it is the projection on the antihelix. So here the antihelix continues, and it is the projection opposite to the tragus. Okay, now if we see the concha part, which is the concha part, it is a ball like area between the behind the external acoustic meatus and in the front of the antihelix. The antihelix, this one is antihelix, and in front of that there lies the symba conchae. Okay, and the superior part is the symba conchae. This triangular part is the this triangular fossa is also called concha. Now between the tragus, this is the tragus and the helix. Okay, this from here the ascending part of the helix, and here is the tragus part. So from the helix and tragus there starts a gap which is known as the incisura terminalis. Incisura terminalis, it is a devoid of the cartilage. Okay, what is the significance? It is the site of the intercartilaginous incision in the end oral approach. Okay, and it also widens the area of the approach. Okay, now if we see the external acoustic meatus. Okay, the external acoustic meatus, it extends from the bottom of the concha to the tympanic membrane. Okay, and it, what is the length of it? It is about the 24 millimeter along its posterior wall. First of all, if we know that it is not a straight tube, its outer part is directed. There are two directions of the external acoustic meatus. Okay, the outer part is upward, backward, and medially, while its inner part is directed downward, forward, and medially. Therefore, if we have to observe the tympanic membrane, pinna has to be pulled upwards, backwards, and laterally, which is also known as posterior superiorly. So let's begin with the parts of the external acoustic meatus or external auditory canal. So there are two parts. First is the cartilaginous part, which forms the outer one third of the canal. Okay, and the cartilage, it is a continuation of the cartilage which forms the framework. Okay, now in the cartilaginous part, what we will see in the cartilaginous part, we will see the skin, the hair follicles, and the ceruminous glands. Okay, now if there is deficiency in the cartilaginous part, that is known as the fissures of the santorini. Okay, which is present antero inferiorly. So if there is hair follicles present, so there can be infection which is called as furuncle, which is seen only in the cartilaginous, and ceruminous glands are used for the secrete the earwax. Okay, now next what we see, that there is a bony part. Okay, now bony part is directed as downward, forward, and medially. Okay, and the lining of that is stratified squamous keratinized epithelium. Okay, now the isthmus, which is the narrowest part of the external auditory canal. Okay, and it is located 5 to 6 millimeter apart lateral to the tympanic membrane. It is also the physiological barrier to protect the tympanic membrane. So, as a foreign body impaction medial to isthmus for the surgical instrumentation for removal. Okay, now what are the deficiencies in the bony part? Such as we learned that the deficiency in the cartilaginous part, it is the foramen fissure of Santorni, and in the bony part, it is the foramen of Huschke. Okay, close as the external aortic canal grows. Okay, and its significance is spreading of infection through the foramen. Now, what is the significance of the that fissures of Santorini? That the spread of otitis externa, okay, along this fissure can be seen, and the spread can be occur through the parotid or the base of skull. If it goes from the parotid, it can lead to parotitis, and if it leads to base of skull, there is involvement of the cranial nerves. Okay, so first, so we can understand here what is otitis externa. Okay, so here it is the infection of the external auditory canal. The etiological factors can be bacterial, fungal, and viral. Okay, and what is furuncle? It is localized otitis externa. Okay, and its causative organism can be staph aureus. Okay, now if we see that what are the clinical features for the furuncle. Okay, there can be pain with or without the discharge, and pain in the ear on jaw movement, which involves the temporomandibular joint, which impinges on the cartilaginous external auditory canal. So middle ear cavity, it is lined by mucosa, and for its examination we can see that there is localized swelling. So in this diagram, if we see that there is furuncle, and how we can observe that it is the part of the cartilaginous part or bony part. So in the cartilaginous part, as we can see, there are hair follicles also present, and there is infection and inflammation. So there is, how can we examine it? How can we examine? So there is a tragal sign in which there is swelling present. So for examination, we could press the tragus, and so it will increase the pressure in the external auditory canal, and significantly there will be increase in the pain, which indicates that there is involvement of the external auditory canal. To differentiate between the referred pain and pain due to pathology. Okay, for the management, there can be used antibiotics and 10% ectomol glycerin pack to splint and relieve pain, and glycerin can be also used. Okay, thank you so much, guys.